Hi, my name is Linda Cook, and I'm the student coordinator for Foothills Therapeutic Riding. And today we're going to be talking about some of the activities that we have designed for our kids who we work with. Our kids have many different difficulties. It's really a soup to nuts situation. Some of our kids have very definite and defined physical disabilities, but most of our children, probably 80% of them, actually have a combination of mild physical ailments, but predominantly are neurological dysfunction. So what we have done in our program is we have designed activities that very specifically get to the balance that the child requires to keep stable on a horse, to keep moving in motion and time. And some of the principles that we use for balance are crossing the midline. This is very, very important because it allows both sides of the brain to develop equally. And so any activity we do from the right, we will also do from the left. Most of the activities are also going to be working with different muscle strengths, predominantly their back muscles, their core strength. Anytime that you work with a muscle, you are going to be affecting different hormones in the body and also neurotransmitters. And that relates to the kids that are having speech and language difficulties, and we have very specific activities to encourage speech and language as well. Next to all of our balance exercises and our crossing the midline, probably next important is our stretching exercises. And while stretching is a good part of any athletic experience, certainly good for our horses and our kids, we are getting in specifically for our kids in the autism spectrum disorder is stretching helps them to release endorphins. And if you have a student coming into us probably with an anxiety disorder as a part of their autism spectrum, what you want to make sure is they're in the best physical way where they're going to be relaxed and enjoying their experience. So the more endorphins we can get on board, the better. So next to balance, probably stretching is the next important in terms of the physical part of their experience with us. Probably the next important to that would be sensory integration. Autism spectrum, which probably comprises of at least 70% of our kids, do not integrate sensory experiences very well. And that's why we're using the horse as a tool for the schools to help these kids perform sensory integration a little bit better. We will use every part of the horse, the feel of their coat, the smell of their tail, the feel of their tail, the experience of being on, the experience of movement, the feeling of air, and the experience of them having to focus on that sensory experience and be spoken to at the same time. So when a child with autism spectrum has to multitask, it's very, very difficult for them. And it requires a lot of patience on our part. It requires using silence as a strategy so that you can give them time to try and incorporate that into the activity. But probably those are the main things. The main things are balance, stretching, and sensory integration are probably the three basic things that we're using in all of our activities to get not just to the children with physical disabilities, but for a large population of kids with the autism spectrum. The primary reason we're showing you all these activities today is just to let you know that this is not rocket science. Anybody can do these activities. You don't have to have any kind of special background. You have to just come with yourself and your big smile. And every activity that you do with these kids will be addressing all of the three basic things we look for, which is balance, stretching, and sensory integration. At Therapeutic Riding, we have developed many resources for the volunteers, of which this is one example. This is a great example of the different things that have been done and research that's been done in the area of hippotherapy and working with kids for physical disabilities. We also have other boards that describe other conditions that you will be working with, and it's a really good idea just to have a look at those posters that have been done for you, because it really does explain the conditions those kids are walking in the door with, and it'll give you a better understanding before you work with them.